Good afternoon. I'm Dr. Ollie Jones, and I am the president of the Ohio Grandparent Kinship Care Coalition. We want to welcome you today to another awesome presentation of information that will be beneficial to you as practitioners and also to you as caregiver providers. Before I introduce our speakers, I would like to introduce Barbara Turpin, who is the secretary of the coalition, and she would like to give you an announcement on House Bill 289. Thank you, Barb.
Thank you, Dr. Jones, and good afternoon, everybody. It's great to see all the caregivers and agency representatives on the meeting today, and I know it's going to be a great informational meeting with the speakers that we have today. We were very pleased to have them be willing to come and present their information about these two important programs, especially around children in the care of the kinship providers. So I hope that everybody is able to get a lot of good information. We wanted to start off just to update you on where we are with the budget bill. It's coming to a close rapidly. The bill is supposed to be signed on by the governor on June 30th, so it becomes effective July 1st. That's the way it's supposed to work. Some years it doesn't, but I guess we anticipate this is the way it's going to work this year. But there's still negotiations going on. There's still committee meetings and hearings going on between the legislators about what's going to be in and what's going to be out. So I think we want to just give a last-ditch effort in contacting your individual senators and representatives and let them know that kinship families matter, kinship families are important, and they need their support. And so I've done a sample of something, information that you can say if you decide to either call in or email your legislators, and I've included how to do that. It's pretty basic. You either call or email, and then you give them your information. Tell a little bit about yourself and what your situation is. And obviously, if you're not a caregiver, but you're an agency representative, you're just an advocate, you can also do this. There's no limits on who can call or contact your legislator about issues. So you just plug in your information into the little speech here. And I think there are three main things that I came up with that I think they're important, that are possibilities. Not saying they're guarantees, but they're possibilities, but we want to let them know these are important to caregivers to continue to support them and be able to provide quality care for each of the children that they take care of. So then at the bottom of the document, there's how you can contact your legislators. There's a website for the Ohio government, and it will bring up the information. And one of the areas that you can access how to find who represents you is under who represents me. It's right on the homepage. You either put in your zip code or your address. It'll bring up who your senator is and your representative is. And then once you get that information, if you want to email them, you put in their district number, say for example, District 48, and then representative, and then their district number, and then the last part is at ohiohouse.gov, and that'll get them, that email will go directly to them, and there's an example of that. And then for your senator, you put the senator's last name in at ohiosenate.gov. So for example, Senator Dolan there, it's Dolan at ohiosenate.gov. Or you can also go and leave a phone, either talk with probably their aide or leave a voice message on their number. And when you go on the main website and you find out who your legislators are, you can click on their website and their information. And in there will be a contact number, a phone number for them. And you can call that number, and generally either an aide will answer or a voicemail will come on, and you do the same thing. Leave the information that you want to leave and let them know that you are asking for their support. This document's also going to be posted on our Ohio Grandparent Kinship Coalition website, and there's the website address. And it should be posted sometime after the meeting. and you can go in there and then see the information and be able to access it to be able to contact your legislators. So again, it's never too late. They need to know this. Even if we don't get this in the budget, they need to know that these supports are necessary for caregivers to continue to take care of the children in the state of Ohio, and that this is a very important role that they play in helping the children in the state of Ohio, as well as helping the state of Ohio itself. So we want them to know this, and later down the road, if they did or didn't support it, you may want to consider that when the elections come back around, and who you support in those elections, because that's going to be important for us to get these kinds of supports in eventually, either through separate bills or in the next budget bill. So that is pretty much it in a nutshell. If anybody has questions, you can send them in through the chat, and I'll try to answer them as best that I can. And thank you, Dr. Jones.
Okay, I'm going to go ahead and introduce our speaker. Again, our topic is Help Me Grow, which is a statewide system of support for pregnant women, caregivers, and families with young children with disabilities and delays. Our first speaker is Beth Hensley. Beth is with marketing and outreach coordinator statewide with Help Me Grow at Bright Beginnings. Also working with fetal alcohol syndrome disorders resulting from exposure during pregnancy, when a mother is drinking during her pregnancy and the child has been exposed to that. Our second speaker will be Alex Martin with behavioral health coordinator, maternal health, child and family health at the Ohio Department of Health. And our last speaker is Karen Kimbrough. Karen is with the Ohio Department of Mental Health and Addiction, Office of Community Treatment Services, Bureau of Children, Youth and Families, Maternal Wellness, Project Led, Ohio FASD Steering Committee Chair. She's a chairperson for that particular committee. As you can see, we have three well-rounded individuals who will be bringing excellent information that we can use not only for our own selves, but for the children that we provide services for, and then for the families that we also touch throughout the community. We're going to give each speaker 20 minutes to speak, and then leave the rest for questions. If you want to write your questions in the chat, we'll be monitoring those chats for your question. At this time, I'm going to turn it over to Beth. Thank you so very much, Beth.
Thank you, Dr. Jones, and welcome everybody. I'm going to pull up my PowerPoint to talk you through it, and I'm going to take myself off camera because it's a little easier that way when I'm presenting. Can everybody see the PowerPoint presentation, the first slide? You guys are all, everybody can see? Okay, thank you.
Yes.
Thank you for having me today and allowing me to talk a little bit more about Help Me Grow. And as Dr. Jones explains, it's a system of supports for children under the age of 3 and their families through 2 different programs. One is the Help Me Grow Home Visiting program, which promotes positive parent or caregiver child relationships for pregnant women and new parents or caregivers. And the other support system under the Help Me Grow umbrella is early intervention. And this provides a coordinated services approach for families with children who have developmental delays and disabilities. Families and caregivers might be eligible for one or both programs, and anybody can make a referral. So anybody, even yourselves or a friend of the family, a medical provider, anybody can make a referral to the Help Me Grow system of supports. So why would somebody want Help Me Grow or need Help Me Grow? Our research has shown that at least 80% of a child's brain is developed by the time they reach age 3. The early years of a child's life are critical for optimal development and provide the foundation for success in school and in life. the focus of today, we're going to talk about home visiting a little bit, and I'm going to give you some details about home visiting and also some details about early intervention. And then I'll allow you, as Dr. Jones had said, we'll have time for questions that I can answer specific to your needs. So the focus of the home visiting part of the presentation is the Ohio Department of Health funded home visiting, providing those services to women who are pregnant and families or caregivers with children up to age 2. The home visiting model is an in-person, evidence-based service that supports pregnant women and families or caregivers who might be at risk and need the services. Home visiting provides necessary resources and skills to raise children who are physically, socially, and emotionally healthy and ready to learn. Home visits are voluntary, confidential, culturally sensitive, and respectful of the family in the family unit. The visits take place in a family's everyday environment. The goal of home visiting is to improve maternal and child health, or caregiver and child health, prevent child abuse and neglect, encourage positive parenting, and promote child development and school readiness. You might wonder why home visiting is so important. Data supports that 48% fewer lower birth weight babies are born to pregnant women who participated in home visiting. Families and caregivers that participated in home visiting were 50% less likely to be involved in children's protective services. And participating children scored 25% higher on 1st through 3rd grade reading and math achievement tests. So that's a very important one for some of the families that you serve and that you assist.
Beth,
Yes.
this is Lisa. You're sharing your full screen with your notes. Can you start the slideshow, like the full screen?
Yeah, I should be. I actually am not even using these. I've got my other ones. To get rid of it. Hold on a minute. I seem to have lost it. All right. Are you seeing the notes still now?
No, ma'am, I don't even see anything because you hid your screen.
Okay.
So you need to reshare your screen again.
Okay. Sorry about that. Okay. Now can you see it?
Yes, ma'am. Thank you.
Okay. And you do not see the notes.
That is correct.
Okay. Thank you so much. So one of the things that we want to look at is who can be referred to home visiting, who can be referred. There are 4 different home visiting models. I'm going to give you this information. You don't have to remember it. All you need to know is if you are interested in Help Me Grow services, I'm going to give you an 800 number that you can call and a website that you could reach out to us. I'm giving you these details, but when you call our central intake line, our central intake staff are very good at making sure at matching up families to where they need to be and collecting valuable information. So the 4 home visiting models are nurse-family partnership, which is provided by a nurse, a home visiting model that's also used to provide support for first-time moms through pregnancy and until the child reaches age 2. The Healthy Families America model is a home visiting model that uses a family-centered approach to help promote healthy growth and development from birth until the child is 3 years of age. Parents as Teachers model provides parenting support to pregnant women up to the child is ready for an entry into kindergarten. And then the Moms and Babies First model is offered to expectant African-American mothers to help support healthy pregnancies, positive birth outcomes, and ongoing education, and support to pregnant mothers and to maximize the child's development through their first year of life. Again, these are all voluntary, home-based, offered at no cost to the family and in an environment that the family feels comfortable. So some of these, as we're talking about kinship, you're not going to be thinking pregnant mom. You're going to be thinking more of the Healthy Families America, where you might provide those, the kinship provider is able to get to receive this program based on income eligibility. So eligibility is slightly different for each model, but overall, it's typically expectant families or pregnant women or caregivers of a child under the age of 2 whose family income meets the criteria, less than 200% of the federal poverty level. So that is a little bit about home visiting. Now, the second type of services that we provide under the Help Me Grow umbrella are early intervention services. And that's the statewide system that provides coordinated services to parents of infants or caregivers of infants and toddlers with disabilities or developmental delays in the state of Ohio. Other services under the Help Me Grow early intervention model would be determined based on a visit with a service coordinator. And again, you don't need to worry about that. You would call into our central intake line, and they would be providing you information and making sure that you are connected to the appropriate resources that you need. So who can be referred to early intervention? If a child has a suspected delay in growth or development, if the child has a medical diagnosis, if the family might have questions about a child's development, maybe they're not talking or crawling or walking or doing certain things that they should be at a certain age. If they are birth to age 3, these are all the different types of scenarios where you may want to have a referral to early intervention. These services for early intervention are not income-based, and there are service providers in all 88 counties. So once a family is referred, eligibility determination is conducted by a team. And this is that team that may look at your child that you are providing care to and seeing what are the different types of services that they might need. There are multidisciplined professionals who use various pieces of information across all developmental domains, including hearing and vision, and they determine what might be best for your child. Children are determined eligible based on the diagnosed condition that's on a state list that medical providers usually determine, documented developmental delay that's also determined with a previous examination, and a developmental evaluation or clinical opinion. So once eligibility is determined, children start to receive a comprehensive developmental assessment at no cost to the family or caregiver. And this is very important, that the family and caregivers are part of the assessment. They help identify the child's strengths, their concerns, their family's priorities or the caregiver's priorities, as well as important information about the child's development through a family assessment. So the family and the team members work together to identify which team member will serve as a primary service provider or the primary person who will work with the child and family. Other members of the team will also work with the child directly or may assist behind the scenes for the primary medical service or primary service provider. Services are provided in the child's home or wherever the family spends their time, wherever they're most comfortable. It could be the park, it could be at their preschool or daycare, it could be at their home. It's wherever the family is most comfortable. An important part of the service delivery for early intervention is to make sure that the children have a smooth transition to other services by the time they turn 3, so that they start to transition into quality preschool. And that in turn is a lifelong journey for them in learning once they enter into the public school system or a private school. So some questions that when I was talking to people who had presented to kinship providers, these were some of the questions they came up with. I'm sure there are more. So related to kinship care, do I qualify to receive home visiting services in kinship care? Yes, kinship care qualifies to receive home visiting. Even if there is a reunification program, if you're working with Children's Services, you would still qualify. How do you qualify? If you meet the home visiting guidelines of 200% of the federal poverty level, you should apply. Eligibility then will be determined by your home visiting provider. So you'll call into the central intake and referral line, you'll give your information, they'll ask you a few questions about your child that you are providing care to and your family information, and then they will set you up with, if you meet those guidelines, the income guidelines, they'll set you up with a home visiting provider. If for some reason you do not, we have a variety of other programs in a community that might be helpful to you. So please feel free to call or have families refer to us and call to make sure that they can receive those valuable services for them, for their child and for their family. So another question was, I only have temporary custody. Can I still get home visiting? Yes, both temporary and full custody situations would qualify for kinship care. This is for home, those are related for home visiting. For early intervention, it's an automatic referral because there are no income guidelines. You'll call central intake, they'll ask you a few questions, but if there's any suspected delay or the child has been diagnosed with a delay, definitely call and we can make sure that you're getting those valuable services and get a service coordinator to meet with you and the child. So I spoke briefly about the other resources, and I'll provide this flyer to you after this presentation. We have community resource directories for all 88 counties, and these provide family support in a variety of categories. Some are assistive technology, audiology, could be housing, could be early child mental health, family counseling. So there's a variety of services in every county that we have access to in these directories. So even if you say, oh, I'm over the federal poverty level, but I really need some information, please call us. And this is our website here, helpmegrow.org. The directories are listed on the website if you just want to take a look at them. But if you need some guidance and help, please feel free to call our 800 number, which is 1-800-755-GROW. And you can call. We have 8 regions in the state of Ohio. So if you call this number, you will be connected to the region in which you would be provided services, and they will help you and assist you in your journey through Help Me Grow, whether it be home visiting or early intervention. Thank you. If there are any questions, were there any in the chat?
If not, we'll move to our second presenter.
And Barbara, if there are questions and you want to forward them to me and I can send them back to you, I can do that to make sure if anybody they think of something after they leave today.
Sure, that's, yep, we can do that. Not a problem. And thank you, Beth, for a very informative presentation and being part of our meeting today.
Thank you for having me.
Okay, we will move to our second presenter. Thank you.
Hello, I'm Alexis Martin from the Ohio Department of Health, and I am the co-chair of the FASD State Steering Committee. And my colleague from the Ohio Department of Mental Health and Addiction, Karen Kimbrough, is also on the line. We are going to talk about FASD in Ohio. Fetal alcohol spectrum disorders. It's an umbrella term describing the range of effects that can occur in an individual whose mother drank alcohol during pregnancy. It may include physical, mental, behavioral, and/or learning disabilities with possible lifelong implications. While FASD describes a range of disorders, FAS is a specific birth defect caused by alcohol use while pregnant. FASDs are caused by a woman drinking alcohol during pregnancy. Alcohol in the mother's blood passes to the baby through the umbilical cord. There's no known safe amount of alcohol during pregnancy or when trying to get pregnant. There is also no safe time to drink during pregnancy. Alcohol can cause problems for a developing baby throughout pregnancy, including before a woman knows she's pregnant, and all types of alcohol are equally harmful, including all wines and beer. To prevent a child from having an FASD, a woman should not drink alcohol while she is pregnant or might be pregnant. This is because a woman could get pregnant and not know for up to 4 to 6 weeks. If a woman is drinking alcohol during pregnancy, it is never too late to stop drinking because brain growth takes place throughout pregnancy. The sooner a woman stops drinking, the better it will be for her and her baby. FASD are preventable if a woman does not drink alcohol during pregnancy. Where do you fit in as kinship providers and community members? You can fit in to provide messaging to community members regarding prevention and no amount of alcohol is safe during pregnancy. Also discussing the fact that anytime you stop drinking during pregnancy can have benefits to the baby regardless, as long as you stop. Also discussing concerns regarding children you are caring for with providers and other entities in the child's care system. So I think it's important to understand that a lot of individuals that have children that have been in foster or adopt or kinship situations, they may have behaviors that they are seeking help for different symptoms, such as attention deficit, cognitive processing, and other delays. And a lot of times those symptoms get treated individually. And then usually it takes a long time for somebody's light bulb to go off, a provider's light bulb to go off and say, maybe this child is suffering from FASD versus ADHD or cognitive, and that explains the whole gamut and we can treat that individual better. And so the importance is that if you do know that mom may have been using drugs and or other substances during pregnancy, the likelihood that mom used alcohol during her pregnancy is high. We know that drugs and alcohol sometimes go together. We know that sometimes people might not use drugs and think they can still use alcohol. So it's important that you keep that in the back of your mind when you're talking to providers and you can raise that question. We do know that not all providers understand FASD or have heard about it either. And so I provided a website here for you. And then further along in the presentation, we'll also give you more information. The other thing is, as kinship providers, we know that you are loving those children, and we know that the outcomes improve and resiliency improves when children are loved and can see love and give love and receive love. Our mission statement is to increase awareness of the impact of alcohol-exposed pregnancies, collaborate with agencies to establish resources, coordinate interventions and diagnostic services for families affected by FASD. The current goals of our strategic plan are to reduce alcohol-exposed pregnancies, that's our prevention piece, increase availability and awareness of services for FASD, that's more of our treatment piece, screening, treatment, and then also develop mobilization and sustainability strategies. Our next strategic plan will be starting July 1 of 2021, and we're excited for that. It's another 5-year plan, and we are just now putting the final touches on it. Our current state of FASD initiatives from 2015 to now. Again, Karen Kimbrough and I are the co-chairs and chair of the committee. We have a 5 strategic plan that we complete and update yearly. We have quarterly steering committee meetings that are currently virtual. We also have virtual trainings. We rebranded our initiative to include the logo. So the old initiative indicated that no amount, what was it? Not a single drop. And so we had gotten feedback that might be offensive to some people that may have drank during pregnancy, or it just wasn't as a great of a phrase. So we did some focus groups and things like that, and we changed the logo, and now we it's no amount of alcohol is safe. So that basically can imply that as long as you stop at any point during pregnancy, that the outcomes will be better. We also have 2-sided cards for community members and professionals. And so there's a link in the presentation to those that are on our websites. Also, we hold annual forums that are held every September. Our next one will be September 7th. It's always the September 17th. It's always the third Friday in September. And we have the save the date working on, and then we're currently getting the agenda and the links to send out for registration. It's always free. We do offer CEUs. So we will forward that information to Barbara to get out to you once we have all the details. We have broad representation on the committee from multiple disciplines, agencies, parents, and state departments. We also have held the last year and then this year an FASD prevention campaign promoting no alcohol use during pregnancy. We are currently working on FASD screeners to be piloted and used in various settings to increase the screening of FASD by providers. We are starting a new 5-year strategic plan. We also are piloting a peer support, family peer support pilot and collaboration. We are also collaborating with trauma-informed care. And then we have the Ohio Fetal Alcohol Spectrum Disorder Steering Committee. And we are always seeking committee membership and commitment to its mission and to carry out its strategic plan. It's open to agencies, organizations, groups, and individuals who have a commitment to the prevention and treatment of fetal alcohol spectrum disorders, education, and advocacy. And we find that the best members are the members who have lived the experience, are living the experience, and can provide us with real-time needs and asks, so that when we go to our state departments and we go to our administrators, we're able to say, these are some things in some areas that we could possibly need addressed, and is there funding to address these areas? We all know that we can sit in offices and we can make assumptions, but sometimes it's very helpful to have individuals living that experience and also can understand and tell us in real time the loopholes versus looking at different studies and things like that. We know that FASD is underreported, it's underdiagnosed. So any feedback we can get from the community is always helpful. I listed some trainings and resources. So Dr. Ergon, who is a neuropsychologist out of Wright State University, is one of our committee members, and she just completed 5 trainings on FASD, and they build off of each other. Currently, we do have 2 posted to the website and YouTube for viewing, and the other 3 will be posted probably within the next month or so. I listed the FASD website. There's an There's a FASD website on the mental health and addiction, the Ohio Department of Mental Health and Addiction. And then there's also one on ODA, the Ohio Department of Health. There's an FASD public service announcement. So if you would ever like to use it, feel free to do so. This is the link. Dr. Chasnoff has trainings and other information. He is an expert in the field of FASD and other sort of neuropsychological areas. He is a medical doctor. There's a listing for the national organization on FAS. And then if you would like to become a member or contribute in any other way, please feel free to fill out the survey. Don't feel like you just have to be a member. If you would like to just receive information from us or pop into some of our meetings, that is fine too. And that is it. If you have questions, Karen and I are here to answer them. Thank you. And then our email addresses, if you ever want any more information, you can email Karen or I, or there's a general FASD email that gets checked.
Okay, thank you so very much. If you have any questions, please type them in the chat. We are monitoring them and we'll answer those ask those at the end of the session. Our last speaker is Karen Kimbrough, Ohio Department of Mental Health and Addiction Services. Thank you, Karen.
Hey, Doc. Me and Alexis had the same PowerPoint. We were doing it together. Okay.
All right, so then I guess we have heard from our presenters. And are there any questions that you'd like to ask either Beth, Alexis, or Karen?
I answered one of the questions in the box.
Okay, what was the question that was asked? I'm looking here.
Do you see it? Is there a FASD screening done?
Yes, ma'am.
And do you have data on whether the rates of FASD are increasing or decreasing? And I answered, at the current time, we do not screen for FASD at birth. We are working to get the births flagged that are identified as NAS. Screening for FASD is not done until at least 2 years old. It's difficult to tell unless you can tell more from that a woman's using drugs than you can alcohol, because it doesn't stay in the system and she might not be drunk at the time of birth. So with the data, let's see, I said, I would have to check on the data. Last time I checked, it had increased. And we do know that drinking has increased during the pandemic.
There's also a lot of good information on the CDC website. They list pretty decent data. But we do know that during the pandemic, that's one of the reasons why the campaign was ultimately approved, even though it wasn't a COVID per se initiative, because they did see rates increasing during the pandemic. So that is why that was able to be approved during the pandemic. And then we just got funded again for another campaign that should be rolling out within the next, I would say, few weeks.
Any other questions for our speaker? This has been some excellent information that we need as we work with family and children throughout the state of Ohio. Before I'll let you go, our next Zoom meeting will be August the 25th. So mark your calendars. There's nothing in July, but August the 25th, mark your calendars. You'll be hearing more about that. Same time, same process. If you have any suggested topics that you want to know more about, we want to encourage you to send an email to me or to Barb Turpin And then we will definitely, explore the possibility of identifying, speakers who can come in and share information on those interested topics. We also have some vacant positions with the coalition. You can go to the website and see what's available. If you may have an interest in becoming more involved in the coalition by holding a co-office position, if so, send your resume in to myself and Barb, and we will share it with the rest of the officers and have a dialogue about that. We hope that you have a fantastic rest of the week, and thank you for your commitment, and pass the word on that we are having these sessions so that we can invite other individuals as well. Thank you so much for your participation, and we'll see you in August.
Thank
Stay
you so
safe.